Welcome to The Explainer. Today, we're going to demystify one of the biggest health challenges out there, diabetes. And to really get what's going on, we first have to wrap our heads around just how big this issue really is.
Let's start with a number, and wow, it's a big one. 38.4 million. According to the American Diabetes Association, that's how many Americans had diabetes back in 2021. That's more than 11% of the entire population. But the scale of this thing, well, it doesn't stop there.
Now, how about this number? $413 billion. That was the estimated price tag for diagnosed diabetes in the US just in 2022 alone. I mean, that's a staggering economic hit that really highlights how widespread and serious this condition is.
And here's the statistic that really drives it all home. It's not just about the cost or how many people have it. Diabetes is the 8th leading cause of death in the country. So yeah, it's pretty clear this is a major health crisis.
So to really understand this crisis, we've got to get right to the heart of it. What exactly is diabetes?
Okay, so that's the fancy clinical definition, right? But let's break that down. At its absolute core, diabetes is a problem with high blood sugar. The body's whole system for managing energy from food just isn't working the way it should, and that leads to way too much glucose, or sugar, hanging out in the blood.
And check out this wild historical fact that shows you just how far we've come. The name mellitus actually means honey sweet. And that's because, believe it or not, early doctors figured out that in people with diabetes, all that extra sugar spills into the urine, making it sweet. It's a bizarre thought for sure, but it perfectly illustrates that fundamental problem. Way too much sugar.
So if diabetes is what happens when the system breaks down, what does a healthy system even look like? How does your body normally handle sugar?
Let's just imagine for a second you just finished a meal. What happens next? How does your body keep your blood sugar in that perfect, healthy range? Well, it's actually a beautifully coordinated process.
Okay, so first, your food breaks down into glucose, and that makes your blood sugar go up. That's the signal. Your pancreas jumps into action and releases a hormone called insulin. Now, the best way to think about insulin is to picture it as a key. It travels all through your bloodstream, finds the locks on your body's cells, and unlocks them. This allows all that glucose to get inside and be used for energy. Once the sugar is safely tucked away in the cells, your blood sugar levels go right back to normal. It's a simple, elegant, and incredibly effective system.
Diabetes is what happens when that elegant little key system breaks down. And it mostly breaks down in two different ways, which gives us the two main types of diabetes.
Now, before we dive into the how, let's just look at the who. One of these types is way more common. About 90 to 95% of all cases are type 2 diabetes. Type 1 is much, much rarer, making up only about 5 to 10% of cases. This slide shows the difference perfectly. So let's go back to our key analogy. With type 1, the body's own immune system gets confused and attacks the very cells in the pancreas that make insulin. The result? No key is being made at all. The sugar is just stuck outside the cell. Now, with type 2, it's a totally different problem. The pancreas is making the keys, but the cell's locks have become kind of rusty. They're resistant. The key just doesn't work right. Or sometimes the pancreas just can't make enough keys to keep up with what the body needs. So you see, one is a production problem. The other is a function problem. And this difference also shows up in when these conditions usually appear. Type 1 diabetes is often diagnosed pretty early, in childhood or as a young adult, almost always before age 30. Type 2, on the other hand, well, it tends to develop later in life, usually after 30, and it's often linked to lifestyle factors. So what happens when this system stays broken and blood sugar stays high for a long, long time? The consequences are pretty serious, and they cause damage all throughout the body.
Having chronically high blood sugar is kind of like having sand grinding away inside your body's machinery, especially in the tiniest blood vessels. This leads to what doctors call microvascular damage. We're talking about retinopathy, which is damage to the eyes that can even cause blindness, nephropathy, which is serious damage to the kidneys that can lead to kidney failure, and neuropathy, or nerve damage, which often causes a lot of pain and numbness, especially in the hands and feet.
And it's not just the little blood vessels. High blood sugar also harms the major arteries. This is called macrovascular damage. This drastically increases the risk of myocardial infarction, that's the clinical term for a heart attack, and stroke. In fact, for adults with diabetes, the risk of cardiovascular-related death is 1.7 times higher. That's huge.
Now, managing diabetes is a real balancing act, because while the main problem is high blood sugar, the treatments, especially insulin, can sometimes push blood sugar too low. This is a condition called hypoglycemia, and it can be pretty dangerous on its own, causing things like shakiness, confusion, and even passing out. But there's a really simple life-saving trick for treating it. It's called the Rule of 15. If your blood sugar is low, you just need to get 15 grams of fast-acting carbs into you, wait 15 minutes, and then check your blood sugar again. It's a super straightforward way to safely get those levels back into range. All right, this brings us to our final section. We've seen the problem, we've seen the risks, so what does the path to actually managing this thing successfully look like? Well, it all starts with having clear targets. The A1C, which is this really cool test that gives you your average blood sugar over the last 3 months, that should be below 7%. Your blood sugar before you eat should be somewhere between 80 and 130, and a couple hours after a meal, it should be under 180. Hitting these numbers consistently is the benchmark for good control. And how do you hit those targets? It really comes down to 4 cornerstones of treatment. It's a whole approach that brings together a smart diet, what they call medical nutrition therapy, with regular physical activity. And all of that is supported by checking your blood glucose consistently. And when you need it, pharmacological therapy, medications that help the whole system work better. So here it is, the most important thing to take away from all this. While diabetes is definitely a serious, chronic condition, it absolutely can be managed. With the right tools, the right knowledge, and just that daily effort, people with diabetes can and do live long, healthy, and really fulfilling lives. And that brings us to our final thought for today. An absolutely incredible 97.6 million Americans have pre-diabetes. Their blood sugar is high, but it's not quite at the level of a diabetes diagnosis yet. Now, that's not a reason to despair. It's a huge opportunity. So, I'll leave you with this question. Knowing that, what role does awareness and just taking action early play in turning the tide on this whole health crisis?